Hey guys, so I haven't made a video like this for a while and I thought it would be fun to kind of answer some comments that have been left on my channel or sent to me in a message. And yeah, so I believe that most of these are either medical assistant or phlebotomy related, but I think I have one maybe medication related question. So I'm just going to read what the person said and then I will respond with my thoughts or what I have to say about it. So this comment was left on my video titled MA Vlog, Restocking the Lab and Ordering Supplies. And this was left by Sally Smith 7014. And Sally said, "You seem really judgmental. If a patient doesn't work in the health field, why do you expect them to know to drink water before having labs drawn?" So I think, first of all, I just want to apologize if I seemed like I was judgmental in any way. From my perspective, like anytime that my provider, when I was working full-time as a medical assistant, anytime that my provider would order labs for a patient, I always made it a point to emphasize, that on the day that you come in to get your labs drawn, make sure that you've had enough water to drink, make sure, that you've had a good meal, stuff like that. Like I've always emphasized that with my patients. And so I guess it kind of came from my perspective where, I'm so used to sharing that advice with my patients that I guess I just kind of forgot that, different providers and different healthcare workers do different things. It was not coming from a place of me trying to be judgmental, but like I've always said that to all of my patients, especially people who I know have a hard time with getting their blood drawn, or people who I know that, like, when I would work at the outlying clinic and I would have to draw their blood, if there was a person who was having a hard time, I would let them know that like they could come back at a later time and just have their labs drawn, because we do nurse visits at that outlying clinic. And so like they didn't necessarily have to have an appointment with the provider. They could just come in and whatever nurse was there or MA was there, they could just draw their blood and that would be it. Like they didn't need to do anything other than that. So I would offer that as an option to patients. And I would also recommend, like, if they did need to come back, I would remind them, to make sure that you've been drinking enough water and staying hydrated, because it will make the blood draw experience go easier. So I guess I apologize for sounding judgmental. It was not intended that way. Like I said, I guess I just kind of forget because I'm so used to telling my patients that all the time. So let's see. Next one. This was sent anonymously to me, and it said, "Would it be acceptable to go to an interview in scrubs if I am leaving straight from work to go there?" So me personally, I would never go to an interview in scrubs because I always am of the mindset that I want to look presentable. Not that wearing scrubs doesn't look presentable, but especially if you've been wearing them at work all day, been running around like crazy. Depending on what your job is, you could be sweaty, like from working all day in your scrubs, because I don't know what this person does for a living, like especially doing CNA work or even just seeing patients as an MA or a receptionist, even like germs and different things could be on your scrubs. And I don't know, I just would never want to go to an interview wearing scrubs. Like I get why people do, especially in the medical field. I do know that some employers are very understanding of the fact, especially if they know that you're just leaving from work. I'm not saying that it would negatively impact you, but I just personally, I couldn't do it. I've always dressed kind of business casual or more than business casual for any job interview I've had, just because I want to make a good first impression and I want to look professional and I want to look like I care about, this position and this organization that I'm interviewing with. Not that if you wear scrubs to an interview that you don't care or you aren't professional or any of the things that I just said, but I just feel like it gives you a little bit of extra boost. I don't know what I'm trying to say, because you're going a little bit above and beyond and not just wearing scrubs. I've never understood why. Like I've known people who I've worked with in the past who have just worn scrubs to an interview just because, like not leaving straight from work just because. And I've never understood that. Like if you're at home and you have the ability to put on something other than scrubs, I would definitely recommend it, just because, again, it makes you look more polished and presentable. And again, not that wearing scrubs doesn't make you look polished or presentable, but it definitely, I don't know. I just feel like when an employer sees that you put extra effort into how you look and your appearance and cleanliness and all those things, it definitely looks better on you. Okay, so this one this comment was left on I got a new job career update, and this person was PMYRA, P Myra, and they said, I don't know if it's a he or a she, said, I am also interested in phlebotomy. Can you give me suggestions? Is this course difficult? So I didn't really think that the course was difficult, but again, I also had previous healthcare experience before I took the phlebotomy course. So it could have just been the fact that I had previous experience working as a CNA and taking other medical related classes, because I did previously start working towards my nursing degree. So, you know, it could just be the prior experience, but a lot of it was just more like common sense to me. The thing that I think I had the hardest time with was memorizing the order of draw, and we ended up making like a little rhyme thing, songish type, that helped our class remember the order of draw. So I think like doing things like that will help you remember those things will be helpful. Other than that, it's kind of just something that you need to practice, especially like hands-on practice, actually drawing blood and putting the needle into the person's skin, feeling for that vein and learning how to recognize what is a good vein and what isn't. I think those are things that will come with practice. And, you know, with phlebotomy, practice is one of the most important things. I don't necessarily think that it's difficult if you take the time to practice and take the time to memorize the order of draw. I will say that on the job, usually, unless you work at a place that doesn't have this type of label system, usually when you go to collect the blood draws, like there will be labels that spit out that say exactly what labels need to be drawn, and that makes it even easier. And like I have on my badge, my work badge, on the back of it, I have the order of draw from top to bottom. Like up here is where you'd start, and the bottom is obviously the last one that you would draw in that order. So getting things like that, or I've seen like pins where it'll have like different beads with the colors in the order of draw. So just having things like that and different tools that you can use to help you throughout your workday, whatever makes it easier for you, is what I would recommend. Okay, and last but not least, this one was left on my video titled Ozempic, What Comes in the Box. And this was left by Haley Griffin 6082. And Haley said, what is it used for? So Ozempic is one that a lot of people were using for weight loss. And it is still something that people are using for weight loss, but a lot of insurance companies will not approve this for people that are not either diabetic or pre-diabetic, simply because Ozempic is actually a diabetic related medication. It does help with your A1C levels, which is basically like it shows your average blood sugar level over a 3-month span of time. So with the A1C, the Ozempic is designed to help lower your A1C to a lower level, which is more acceptable, which is helpful for your body if you are someone who either deals with insulin resistance or diabetes, things like that. So that is what Ozempic is used for. I am somebody who has insulin resistance from PCOS. And so my previous provider that I was seeing for weight loss and all of that, he prescribed that to me to, one, help with the insulin resistance, which is why my insurance approved me taking Ozempic, is because I have that insulin resistance. So I'm at a higher risk for developing diabetes. And I have made other previous videos where I have discussed kind of being at risk for prediabetes. And when I had testing done that showed that I was kind of in that pre-diabetic range, right now I had my A1C done when I was in the hospital recently, and it is at a very good normal level. I'm not in the pre-diabetic range anymore. I'm at a normal non-diabetic level. But we don't know if that's because of like the weight that I've lost or the dietary changes that I've made or the Ozempic or the metformin that I also take for weight loss and PCOS, or if it's just, you know, my body adjusting to losing the weight. So my new provider and I have discussed like stopping the Ozempic and the metformin and kind of seeing how my A1C does with that. We haven't really figured out if we're going to do that yet or not. I'm kind of still trying to get back to normal after all of this liver craziness. But yeah, that is what the Ozempic is for. If you guys have any other questions, I would love to make more videos like this answering your questions. I kind of wait until I have enough questions to make a video like this. I think usually when I get like 3 or 4, sometimes 5, depending on the type of question and my elongated answer, because you guys know that I can tend to ramble. I usually wait until I have a few questions and then I try to make a video talking about it. So anyways, thank you guys for asking these questions. If you guys have any other questions, feel free to leave them in the comments below or in the comments on any of my videos. You know that I am more than happy to share my knowledge and experiences with you guys, and I hope to continue doing so. Hopefully my health gets better so that I can start doing my normal everyday things again. That would be really nice. But anyways, that is it for this video. I hope you guys are having a wonderful day, and I will see you guys again soon.